Hi fur parents! So recently, Diamond gave birth to her litter through C-section. Caesarean section was the best option we had because the puppy was blocking the way out of the vulva. I will show you the C-section aftercare in dogs. After surgery, your dog will not have enough strength to stand up. Let her rest for at least an hour or two. Once she became conscious and regained her strength, let her urinate, defecate, eat, drink, and settle down to reduce anxiety and stress so she is well settled before the pups are introduced. It is also important to wipe the mother dog's nipple using a clean cloth to remove dirt that may harm the puppies. Be extra careful on the wound when wiping. Now, it's time to slowly introduce the puppies to Diamond. This is their first time meeting each other after the surgery. I can't wait to see the reaction of Diamond. The first thing that I did is that I just let her first smell her puppy and then afterwards I placed it beside her. As your female dog has delivered a litter by cesarean section, she may not mother effectively in the first days of lactation. It is at least possible that she will actively reject the pups and could harm them. It is vital that the interactions between mother and babies are very carefully monitored and supervised. At best, she will form maternal neonatal bond over the next few hours. At worst, she can be aggressive towards the pups. Effective lactation and nursing are essential in the first 2 days, and you should do whatever is necessary to encourage and facilitate this process. Pups that do not feed well in the first 2 days of life may die or be debilitated later. Feeding is accomplished by lying the mother dog on her side and assisting the pups to find the nipples as needed. If the mother dog tries to move, sitting behind her back, hold her legs closest to the ground, which will help comfortably restrain her for feeding. A bloody vaginal discharge is normal for 3 to 7 days following birth. It may be quite heavy for the first 1 to 3 days after delivery and then begin to diminish. If it continues for longer than 1 week, changes color or develops an odor, the mother should be checked for the presence of infection or other complications. The mother dog should be fed a premium brand high-quality dog food while nursing, in order to provide appropriate nutrition for her and her litter. It is best to check the mother dog's mammary glands each day to check for redness or hot spots, which could be the start of mastitis. The surgical wound has layers of internal dissolvable stitches. Do not allow the dog or any other pets to lick at the wound, as this will cause infection and the wound to break down and possibly need restitching. Try to keep your dog as rested as possible for 7 to 10 days post-surgery, as too much moving around may delay healing and cause swelling at the site of the wound. Check the wound daily for any redness, swelling, or ripping. And if the wound is becoming sticky between the mammary gland, then you can gently clean with a clean cotton pad and some cold boiled water. Make sure that the wound is dried completely afterwards. So, when will the mother dog stitches be removed? The stitches may or may not need to be removed, depending on the type of material used. As for Diamond's case, the veterinarian used internal, absorbable sutures that will not be visible and do not require removal. As a general rule, if the stitches are visible, they will have to be removed, usually 10 to 14 days after surgery. If skin staples were used, they will also require removal in 10 to 14 days. When it comes to feeding the mother dog, you should offer her small amounts of food and water frequently, every 15 to 30 minutes, for the first 24 hours after surgery. If she eats or drinks too much or too quickly, she may vomit. Her food intake at this time should be about 1.5 times her normal food diet. Thank you for watching. Don't forget to like, subscribe, and share our video.